Hi everyone, this is Neel Raithatha here, also known as the Wax Whisperer. Thank you for joining me in this special edition video of the 10 most bizarre foreign body extractions that are performed to date. And coming in at number 10 is a hearing aid battery. So this patient had mistakenly inserted this battery in their ear instead of the hearing aid, but fortunately I was able to use a magnet stick to remove it. So quite often patients with poor dexterity struggle to remove the battery from their hearing aid, so we provide them with this stick which has a magnet on one end, and I felt that was the best tool to remove it. So this is number 9, and what you're seeing here is a silicone tip that's attached to one of these DIY home earwax suction devices. It almost looks like a hairdryer. I've got a still image coming up, and when they inserted this, the silicone tip itself got trapped and detached itself from the device itself. So as you can see, it doesn't look the safest device, and I don't think that patient would be using that anytime soon. Patient number 8 was a child who at school pushed some Play-Doh into their ear, and they pushed it pretty deep actually. This piece of Play-Doh measured around 1 centimetre if I was correct, and I'll just use microsuction here to lift this off the floor of the ear canal and slowly wriggle it out. There we are, and we're just going to go back just to make sure everything's okay, and as you can see, no harm done. And coming in at number 7, what have we got here? I remember this one. So this is of a patient of mine who suffers from really itchy ears, and to relieve their itch they started to scratch their ear with the end of a pen, and believe it or not, what you can see there is the end of the pen. So it's the little cap that sits at the end. So I'm assuming that was partially loose before they inserted it in the ear, and after giving it a little wriggle it came apart and remained in the ear. But once again, fortunately on this occasion, no long-term damage sustained to the ear canal or the eardrum. Number 6, this is of a young child who lost one of their baby teeth, and instead of it being placed under their pillow at night for the tooth fairy to come, they decided to put it in their ear. And both I and the child's mother at the time were just completely unaware of what this was, and we placed it on the tissue. We were kind of touching it, feeling it, getting to get the consistency, and it just felt like enamel. And then it dawned upon the child's mother that this was their baby tooth, because it did go missing under their pillow at night, and it was stuck to the eardrum. So the patient did very well indeed, just to remain still. So this, believe it or not, is an earring stud, and this patient is actually the partner of a friend of mine, and he rang me in desperation because he was partly to blame. So this patient had an old tragus piercing that had closed up a little bit, and their partner wanted to see if they could put their earring back in. So my friend volunteered, and he pushed it straight through the tragus piercing into the ear, and as you could see, that was stuck. The bottom end was stuck to the patient's eardrum. This is of another child who had pushed a popcorn kernel, of all things, in their ear, and it was surrounded by wax. So I started off by performing microsuction, but when you've got a spherical object like this, it can be very difficult to suction because you don't get the suction grip, and it is quite deeply lodged. Fortunately, there was an opening at the top, so I reached out for an ear hook, and I managed to just glide it through that opening and slowly bring this out, which I did. The last piece is just stuck near the entrance, so I'm just trying to get the camera steady there. So a young child is moving around a little bit, and again we're going to go in and behind with the hook, and eureka, we managed to remove that. So when I re-entered the patient's ear, this popcorn kernel had pushed a lot of wax and dead skin really deep, so we're now going to remove this. So I'm just using microsuction, which is a little vacuum device that we use to suction earwax out of the ear. So this is some dead skin that the popcorn kernel, as it had been pushed in the ear, had grazed off the side of the ear canal, and the remainder of this wax is impacted, it's stuck to their eardrum. So we need to remove this just to make sure there's no underlying trauma caused. Whenever anyone puts a foreign body in the ear, the main concern that we have as audiologists is that they may have perforated the eardrum. So we want to make sure that the eardrum is intact. So managed to bring that away. Again, it just got trapped near the entrance. So this entrance of this patient's ear canal is quite narrow. So they did very well indeed, actually, pushing that popcorn kernel in. So you can see the majority of the eardrum there. It's just a little bit more wax. It looks healthy enough. There's no perforation visible. There's no bleeding. There's no bruising. So again, just going to delicately suction that away. So we're using the quieter suction tip here. This is a smaller one, which is narrower, so we can place it deep in the ear with better visibility, and also it's quieter for the patient. So again, fortunately on this occasion there's no long-term damage sustained, and I'm just mopping up around the edge for the patient now. And just going to have another look just to make sure we've not missed anything. And I've got a nice still image for you guys of that popcorn kernel. So I gave it a good wipe with a tissue to get all the residual wax out, and yeah, you can see just how spherical it was, and they can be very difficult to remove when they're this round and glossy. So we are now going to move on to our top three. Now this is a complete incidental finding. This patient attended the clinic alongside their mother who had earwax, and whilst the daughter was in attendance, they just asked whether I would be happy to look in their ear, and wasn't expecting to see anything at all, really. But beyond my disbelief, I noticed this black sharp object, and at first we just did not know what it was. And after further questioning, the patient then said that they've got a habit of scratching their ear using one of these fine tooth combs. So what you saw there was the end of the comb, one of the tooths that snapped off. And this patient was really, really lucky actually, because the pointed sharp end was facing towards their eardrum, and I think it was over a centimetre in length. I think I've got it beside a ruler. In a moment you'll see the length of it. And if that had gone in any further, this patient no doubt would have punctured their eardrum and caused severe trauma. But they were very, very lucky. And I'm glad the patient did ask whether I was able to look inside the ear. So we just got a still image of their ear after the removal of that tooth comb. And as you can see, yeah, I've got it beside a ruler, and it is 10 millimeters in length. So this is of a recent case of a patient who had used a TP dental floss brush. And again, there's a bit of a trend here. They've suffered from itchy ears, and they had used this to try and relieve their itch. But as you can see, the handle has snapped off, and just nearest to us, there's that metal rod that runs through the center of this brush that connects to the handle. And I started off using an ear hook. I managed to bring it forwards. I wasn't sure whether forceps will grab onto this this brush, because the little brushes on there are so fine, but fortunately, as you can see, I managed to grip onto that. So if you do have itchy ears, I know it's easier said than done. There's always that temptation of scratching your ear, but do go and visit your doctor or your ENT or audiologist. There may just be some earwax. You may be suffering from eczema of the ear, and quite often there's things that can be done to help you with your symptoms. But whenever you're scratching inside your ear, you're always running the risk of causing trauma, further impacting earwax, grazing the skin, which can then lead to an ear infection. So fortunately, again, there's no long-term damage sustained here. They had pushed some earwax and dead skin quite deep in the ear against the eardrum, so we're just going to suction that away. So in the distance, that's the patient's eardrum, and I'm using a fine suction tip here to delicately vacuum away some dead skin that they had pushed up against the eardrum, and we're just releasing it from the the roof of the ear canal there. So the reason why this patient suffers from itchy ears is they've got a condition called otitis externa. It's a chronic condition where they have a high dead skin turnover in the ear, and this skin that lines the ear canal and the eardrum, in the majority of the population, as it dies and sheds, it naturally moves sideways out of the ear, so the ear cleanses itself, it sheds itself of the dead skin. But unfortunately in this patient, because they generate such a huge amount of dead skin, as it sheds, it just collects in the ear canal. It can't naturally migrate, and that can cause itchiness in the ear. There's just a little bit left at the front of the ear canal, so I'm just going to gently peel that away. But the eardrum is healthy enough. Again, there's no trauma or bruising or bleeding caused. And there's just a bit of skin left, I think, maybe at the floor of the ear canal. We'll have a look. But I'm just having a good observation. I don't want to miss anything, because it was quite a long TP dental floss brush. So we just got some dead skin here at the entrance. We're just going to get that in focus. I'm going to delicately remove this away. So the ear canal looks quite healthy as well. There's no erythema or inflammation. There's no cuts or abrasions caused by that device. And just going to remove a bit more skin at the entrance. So whenever you're poking in your ear, you are grazing the side of the ear canal. So all that skin that I removed was as a result of this patient poking and prodding in their ear. And there's that TP brush. So it weighed in, or should I say measured up, at 15 millimeters. And considering the length of the ear canal is 2.6 centimeters, 26 millimeters, it was substantially filling up their ear. Last but not least, this was, I don't ever think I'll come across a case like this. It's of a patient who wears hearing aids, and they went to their audiologist because they had noticed that the filter, so most hearing aids have these little wax guards, filters at the end, the part that enters the ear. And the function of these filters is to stop the wax from entering the inside of the hearing aid. And these need replacing on a regular basis if someone suffers from earwax. But what this patient had noticed is that when removing the hearing aid, the filter had gone missing. So their initial suspicions were that it just fell out and rolled on the floor somewhere, because they didn't feel anything in their ear. They did not feel any pressure or pain or any hearing loss. So they went to their audiologist, reporting a fault with the hearing aid, which of course there was. They kept having to change filters and they kept going missing. So the audiologist examined the inside of the ear, and to their shock, they had noticed that this ear canal had been collecting full of these filters. So they weren't falling off outside the ear upon removal. They were actually falling off inside the ear whilst the patient was wearing it. And the audiologist initially had counted 10. So that's what I was expecting. But at the end, I actually lined them all up, measured them up. And to my disbelief, there were 22 of these filters inside this patient's ear canal. And some of these are actually stuck on the eardrum. So I'm using a combination of microsuction and also forceps. Some of them came away really, really easily, the loose ones, but some I had to maneuver off the eardrum. They do have quite a bendy ear canal, so navigating the ear was quite tricky. So we can just start seeing the eardrum. So to the right of the suction tip, that blue tinge, that's the patient's eardrum. So all of these now are lodged, and the eardrum has a sticky surface. So it's not always straightforward to remove these because they are adhered to the eardrum itself. There's just a bit of dead skin here. We're going to move that out of the way. And by now, I've completely lost count of how many filters are removed. So this is one that was a bit tricky. It was a bit higher up on the eardrum. It was stuck. They are made of silicone, so they are slightly soft, fortunately. So if they were made up of a harder material, it would have been really uncomfortable for the patient, and they would have certainly noticed. Now, if there was just one or two filters that were in the patient's ear canal, there's always a chance that it might migrate. However, having saying that, when you wear a hearing aid, even if this is slowly migrating out the ear, the hearing aid itself is going to push it back in. So it's a good job that the patient visited, and we can remove this from the ear. So I think, is this the last one? We shall have a look in a moment. No, we've got a couple more that are hiding away, and these two are also attached with some earwax. So you can see that brown, dark brown substance there. And this is really stuck, so I'm trying to pull it away from the front part of the ear canal. And I think there is just one more. So let me know, guys, in the comment section whether you agree with the lineup of this top 10, or do you think they should have been ordered in a different way? There are a few omissions from this top 10 list. There was a patient who attended with a twig in their ear, a stone, a plastic part of a close tag, and I had, of course, several patients who attended with blocked cotton wool buds that's stuck in the ear, or earbuds from ear devices. But for me, this is how I feel in terms of the bizarreness of the foreign bodies, that they should be arranged. But we're interested to see your thoughts. Well, I hope you enjoyed that compilation video, guys. And please remember, you should never put anything smaller than your elbow in your ear. Take care, bye.